Hi, this is Peter Banwarth. I'm the data scientist at Benton County Health Department, and I'm going to talk through a short presentation thinking about what life looks like in a community with low levels of coronavirus. So in this thought experiment, let's suppose that you have a network of 1,000 friends and neighbors. Maybe in actuality you have a network of 500 friends and neighbors, maybe it's 2,000, but let's stick with 1,000, represented by all these people here in these little circles. And over here on the left, well, that's you. In Benton County, we estimate that currently there are about 2 people out of every 1,000 who have a COVID-19 infection. Here's one person, and there's another. Now let's think about, as you go about each day, you randomly meet about 50 of your friends. Can't show all 50, but as we go about each day, there you are meeting some friends, meeting some other friends, just going about your day. Different friends every time, maybe some overlap. And our question is, well, what are the chances that as you go about your day, you happen to encounter one of those people in your network who has COVID-19 infection? So with a network of 1,000 people, if 2 of them have COVID-19, then on any given day, if you meet 50 random people, you have about a 1 in 10 chance of being exposed. So that's pretty important to think about. 2 out of every 1,000 people have COVID-19. That's a very small proportion. But if you're meeting 50 people, you actually have about a 1 in 10 chance of being exposed. And over the course of a whole month, if you meet 50 random people each day, you could be exposed to someone with COVID-19 as many as 3 times during that month. Now, there are many ways to reduce the risk of being exposed to COVID-19. For example, if you reduce the number of people you interact with, the risk decreases. If you meet 50 people a day, then as we said, you might have 3 exposures each month. If you reduce that to 20 people a day, then you might have 1 exposure each month. However, this kind of social isolating is difficult on people, and many community members are unable to do this. Think about medical workers, baristas, and school teachers, among many others. There are other ways to reduce your risk of contracting COVID-19. If we all wear masks and maintain good physical distancing from each other, the risk of infection goes down, even if we do meet someone with COVID-19. That's the advice we've all been following for the past couple months, and public health recommends that we continue to follow it. Keep in mind, though, that the risk is never zero, and again, some people will be unable to consistently use these protections. The very best thing we can do as a community is to find, treat, and safely isolate people who are infected with COVID-19 until they recover. If people can get tested when they feel sick, get medical treatment when they need it, and safely isolate for 2 weeks without fear of going hungry, losing their jobs, or losing their housing, we could see some amazing results. If we can safely isolate just 1 out of every 2 people with COVID-19, your monthly risk of exposure could decrease from 30 exposures each month to just 1 exposure each month. Furthermore, finding, treating, and safely isolating people will slow the spread of disease, greatly reducing the risk to everyone. Here we see the disease spreading through your network, but if we are able to safely identify and isolate one of those people who had COVID-19, we can greatly reduce the total number of infections in our community, which reduces the risk to you and to everyone else. So how can you be a public health champion? Limit your interactions with other people if you can, while still staying socially connected. Wear masks, wash your hands, and practice good hygiene. If you feel sick, call your doctor to see if you should get tested. Stay home until you feel better, following your doctor's advice on just how long that should be. If you, a loved one, or a neighbor need support while isolating, there are places you can get help. And help your fellow public health champions by following the recommendations of public health professionals. And find sources of renewal for your body and spirit. This is a difficult time for all of us, and by taking care of ourselves, we are able to better take care of others. That's the end of my little presentation. I hope you all have a great day.